Good afternoon, colleagues. I'm speaking to you from the second floor Dartmouth group practice. Normally at this time of the day, this practice would be a hive of activity. Faculty, staff, and students caring for all the patients that we normally see. We are all experiencing the impact of the COVID-19 health crisis. This impact is being felt globally, statewide, and at the university and school level. In the past week, all of us have faced disruptions in our daily lives, in our work lives, and in our personal lives. These disruptions are changing on a daily basis. We all share a deep affection for our school and our work, and we have a strong sense of community. This is being tested now as we adapt our daily lives to protect each other, our families, and our patients, and to help our medical colleagues. Our communications to you have been sporadic simply because we don't want to keep overwhelming you with updates that are shifting and changing daily. So far, we've been through several phases of change here at the university and at the dental school. I wanted to update you on some of those changes that have affected our education, research, and clinical missions. Many of these changes are guided by committees from the university that are also meeting and communicating with us daily. Each school is then applying practices that are pertinent to their own missions and operations. Our first changes apply to our educational mission. The didactic curriculum has, for all intents and purposes, shifted to an online distance education model. Our academic affairs continuity team has led this effort in a relatively short period of time. Our course directors and faculty have been flexible and engaged in these changes. Unfortunately, our preclinical and clinical operations have been curtailed as a result of evidence-based resources and guidelines that we monitor on a daily basis. We remain committed to exploring all options that will allow our students to progress in their programs. There are discussions taking place with national organizations to facilitate these changes. The future of these programs is dependent on the information we receive and monitor on a daily basis. You will be receiving updates on our preclinical and clinical programs and operations as they develop. Currently, we are providing emergency care to our patients of record using modified protocols and state and local guidelines for best practice. This effort has been led by our clinical continuity team and a team of faculty, residents, and staff that are being led by Dr. McGarry. We thank them for this service. Our research continuity team is working with the university to provide guidance to our scientists, postdoctoral students, and their staff. Many activities are being ramped down based on best practices. Our student affairs team continues to work on admissions, financial aid, student communications and outreach, and student health and wellness. Our development and advancement team is reaching out to all our alumni to keep them aware of the changes that are impacting our school. Our faculty and staff have received guidance from the university about their well-being and how this crisis might affect their work at the university and at the school. Many have also had their lives disrupted, and most are working remotely as of this week. All of you will receive communications from the various leadership groups as the situation unfolds and as new information becomes available. Class leadership teams have been tasked to field student concerns and to communicate with our student affairs and academic deans as appropriate. Residents should also dialogue with their program directors as needed. In the last 2 weeks, we have already overcome tremendous challenges. Although we will continue to be faced with new challenges, It gives me great confidence to see what our community is willing to learn, adapt, and adopt in these difficult times. I know that as things close down around us, there is one thing that will not shut down: our resilience. Thank you.